Chronic constipation treatment at Constipation Clinic, Sunway Medical Center. Constipation is more than an occasional inconvenience. For some, it's a long-term struggle that affects daily comfort, confidence, and quality of life. Chronic constipation is defined as difficult, infrequent, or incomplete evacuation of stool. Usually fewer than 3 bowel movements per week, lasting 3 months or more. Symptoms include straining, hard stools, a feeling of incomplete bowel emptying or anal blockage, and the need for manual maneuvers like finger evacuation. Functional constipation can occur due to slow movement in the colon, normal movement, but poor evacuation. Or obstructed defecation syndrome, where muscle coordination is disrupted. In obstructed defecation syndrome, the pelvic floor and anal sphincter muscles fail to relax during defecation. Instead, they tighten, blocking stool passage and making evacuation difficult or incomplete. People at risk of obstructed defecation syndrome include those with chronic constipation or straining, high stress levels, multiple pregnancies and vaginal deliveries, previous abdominal or pelvic surgeries, pelvic injuries, as well as conditions like anal fissures and hemorrhoids. Anorectal manometry is a key test that measures muscle coordination, rectal sensitivity, and pressure patterns to identify obstructed defecation syndrome. The mainstay of treatment is biofeedback therapy, a guided, non-invasive training that helps patients coordinate abdominal pressure with pelvic floor relaxation. Using visual and auditory feedback, patients retrain their muscles to work in sync, achieving lasting relief and results. At Sunway Medical Center, our constipation clinic, led by Dr. Wendy Lim and Dr. Sarah Vannon, combines advanced diagnostics and specialized therapy to help patients regain control, comfort, and confidence. Please scan the QR code to find out your constipation level.